You gonna have a lick?
India Stoughton and her husband moved their lives back home to England from Turkey last year to start a family. Little did they know they'd be in for another long journey when it came to the birth itself. That's despite plans for baby Zoya to be born just down the road at Eastbourne's District General Hospital.
I went into labour on a Friday night and I called up the unit at 2:30 in the morning to say that my waters had broken, and they said the unit's open now but we're closing at 6:30 in the morning, so if you've had the baby by then you can have her here, otherwise you'll need to go to Hastings. So we took a taxi to Hastings. It's a really long way to go by taxi to Hastings. It took us almost an hour. It's a really upsetting state of affairs, especially for first-time parents who are already anxious about giving birth, I think.
Official data obtained by the local Liberal Democrats and shared with ITV News Meridian shows that Eastbourne's midwifery unit was closed for births on 87 days in 2023. That means it was shut 24% of the time. Some local parents are also unhappy with the closure of another service here, the short-stay paediatric assessment unit. It was somewhere Helen Diplock's 7-year-old daughter Rosie visited regularly after being born with Down syndrome, congenital heart disease and damaged lungs.
For us as a family, it had become a safe space for us to go to, because when you've got a child with quite complex and scary health needs, having a unit down the road that you can take your child to, and they know her, they know you. And so actually it was a bit like losing one of our limbs in some ways. And when we've been to hospital since they started to reduce the services, it's not the same at all. So yeah, really gutted.
And their concerns.
Local politicians tell me that the future of services here will be a key issue at the forthcoming general election.
It feels like our health services are being eroded in Eastbourne, and that is not good enough. This is, the town that I was born in. I was born in that hospital. It means so much to me and so much to people across our town. We must preserve them, which is why the government must intervene.
I have spoken with the Health Secretary, I've spoken with the Minister, I'm speaking with the Hospital Trust, I'm speaking with the ICB. Most importantly, I'm speaking to parents. Confidence in the proposals and in the changes is absolutely vital.
This hospital is at the eye of a political storm, facing criticism on two fronts, both over its inconsistent maternity services and the overhaul of its paediatric care. Despite all that concern, no one from the NHS Trust was available to speak to us today to defend their decision-making. In a statement, an East Sussex healthcare spokesperson said the pauses to births in 2023 were related to us needing to ensure safe staffing levels across our maternity services. We are continuing to work hard on both short-term and long-term solutions to our midwifery staffing issues. The spokesperson added, previously a small number of children were supported by the short-stay paediatric assessment unit. The improvements we have introduced mean that all children will be seen in the paediatric area in the emergency department. But for current and expectant parents, concerns over the level of care available for their family at their local hospital are unlikely to go away anytime soon. Kit Bradshaw, ITV News, Eastbourne.